So, good morning. It is June 20th, is it? The
I
20th?
think so, yeah. It's the 20th.
Okay, and we have a senior student report being given today by our wonderful Tess Clabby, soon to be our birth professionals of the Bay Area birth keeper doula, certified distinguished doula, which means that she has met and exceeded the benchmarks for this class. So we're incredibly proud to hear her report today. You could let us know what it's about. And I'd love you also to share the story of the subject, what made you want to write about this, and what you gained from your research.
Absolutely.
Mm-hmm.
So, I decided to write about racism and reproductive health care. And we could choose any topic relating to pregnancy, birth, or parenting. And when I was thinking about what topic I wanted to write about, I was thinking about what would I learn a lot from. The idea was to do a whole bunch of research and write this paper. So I was like, okay, what am I going to gain the most from? What am I going to learn from that I might not learn about otherwise in the experience that I'm gaining and will have going forward? And just a little bit about my history and how it relates to this. I am white, if you can't tell.
Mm-hmm.
And I grew up very privileged, middle class lifestyle, and pretty just shielded and blinded to my own privilege, unaware of it in a lot of ways. I just wasn't exposed to a lot of things that people who don't have that privilege are exposed to.
Mm-hmm.
And so it was pretty much when I started working with women of color, specifically low-income women of color, that I started to sort of learn about the things that they were dealing with that were unique to them, and the struggles that they were facing that the white women I was working with weren't having to deal with. And so they ended up being really important teachers to me. That sort of started the process of looking at myself and unpacking my own privilege and figuring out where I was coming from, and figuring out where they were coming from, and realizing that there was really a lot here that I had had the privilege of being able to ignore previously. In addition to working with women of color as a doula, I also have been lucky enough to be in community with a lot of birth workers of color, who I've learned a lot from and who have challenged me on the topics of race and inspired me to really dig deep into that and into myself, and have, helped me really question what does it mean for me to be a white woman working with these women of color, and looking at the relationship that they have with the medical staff. So this all sort of is what inspired me to write about this topic. And once I sort of started to do a little bit of research looking into sort of the history of the reproductive rights movement, I started to learn that what I thought I knew was really only one side of this story. It was the white story, the white feminist story, and that's not a story that explains why Black women are 4 times more likely to die in childbirth than white women. So it felt important to me to really look at that history to figure out how we ended up where we are today. Because if we don't, and then looking at that history, I also saw how it was largely a history of white feminist organizers ignoring the issues that women of color were facing and that poor women were facing, because they weren't having to deal with those issues. So looking at where we are today and looking at how we can move forward and not make the same mistakes that we made in the past, I think it's really important to understand this history, and to look at how we can really start to tackle these issues of racism as they pertain to reproductive health care and reproductive rights, and focusing on the people who are the most oppressed, because if they can't be liberated, then none of us can be. So
good deal. Thank you.
I'm going to read the paper.
Please.
I didn't print out a copy of it because I wanted to save some trees, so I apologize. I'm going to be reading off the computer. But
not a problem.
This is my report.
You're ready.
As a young, white, aspiring midwife with middle-class parents, I thought I knew, for the most part, the story of birth in the United States. Once my interest in birth was piqued, I began devouring books on natural birth and midwifery, checking out birth documentaries from my university's library to watch in my free time. I thought I knew the story of home birth and of home birth midwives. I thought I knew the struggles facing birthing women today. I did not realize that my privileged perspective was allowing me to only see one story. It's the story that gets told the most frequently, and it's the story that gets told the loudest. But it is the story of the middle-class white birthing mother, and it is not the story of all women. The story does not explain why Black infants are more than twice as likely to die during the first year of their lives than white infants. The story does not explain why Black women are 3 to 4 times more likely to die in childbirth than white women. That story is far more complex and is not the story of all women united, fighting for the same rights that I thought I knew. Different women have different stories and have been fighting for different rights. It has not been one cohesive movement, and thus is difficult to see as one cohesive story. I will not attempt to tell that story here, for I know I cannot do it justice. I simply hope to begin to explore that story, to begin to put together some of the pieces that have been missing from the story I thought I knew. The story of the fight for safe and legal access to abortion and for access to birth control is long and multifaceted. Rather than attempting to detail this entire storyline, I'll focus on a few key movements and moments that are particularly relevant to exploring the way this story has been whitewashed. In the pre-Roe v. Wade era, women of all races and classes struggled with family planning. These struggles looked very different, however, depending on the woman's race and class. Many women sought the help of unsafe practitioners to perform abortions for them, and many women resorted to attempting to abort themselves. These procedures were very dangerous, and sadly many women died. However, women of color died from abortion-related complications almost 4 times as often as white women. This had to do largely with their access, or lack thereof, to quality health care. Middle-class white women with access to private physicians benefited greatly from their guidance. Many private physicians performed illegal abortions safely for their patients who were able to pay for their services. Additionally, women with private physicians had access to expensive fertility control, which was available to those with the privilege to access it long before it was legal. In short, quote, women with access to private doctors and the information they dispensed were safer reproductively, end quote. Unsurprisingly, the women with access to private doctors and the benefits they provided were also the women with the most political sway. In Pregnancy and Power, A Short History of Reproductive Politics in America, Ricky Solinger points out that feminist organizations in the 1920s did not want to associate with the birth control movement, which threatened to undermine the ideology of feminine chastity that gave them some political power. However, these were middle-class white women in these organizations, and they had access to private doctors and thus birth control. They were able to distance themselves politically from a fight that sought to give the same reproductive freedom they already enjoyed to women of lower social standings. Ironically, the fight against fertility control began in the late 1800s, before which time fertility control techniques were used widely with little public commentary, as more married, affluent white women began getting abortions, and the eugenics movement gained popularity. Concerned that abortions were depleting the population of Anglo-Saxon whites and risking, quote, the racial future of the United States, end quote, eugenicists and physicians began to fight to criminalize fertility control. They criminalized abortion and birth control in order to ensure that Anglo-Saxon white women would continue to reproduce their race. Politicians' motives are revealed by the fact that abortion prosecutions almost only concerned white women. Solinger sees this as evidence that, quote, law enforcement defined which women's bodies required policing and which women's bodies existed beneath the law, end quote. However, Because affluent white women still had access to fertility control, and women of all walks of life were seeking abortions by almost any means necessary, the eugenicists' goal of maintaining what they saw as the proper racial balance was not fulfilled. They were not able to force Anglo-Saxon white women to have children, so they turned to forcing women of color not to have children. For women of color, the fight for safe access to abortion and birth control is inextricably tied up with the fight against forced sterilization. Sadly, there are far too many examples of the forced sterilization of women of color and poor white women in the United States. Many women underwent the operation without having had it explained to them, and without the understanding that it would prevent them from having children in the future. Many were simply told that it was for their own good. Some women were coerced into having the procedure. One woman recalls being told that if she did not have the operation, they would take away her welfare benefits. Meanwhile, affluent white women were denied sterilization as an option of fertility control. So although poor women and women of color had a vested interest in being able to limit the number of children they had, especially when they had to struggle to put food in their children's mouths, they were also extremely wary of birth control clinics and organizations promoting fertility control because they were also fighting for their right to be mothers. Many women of color stayed away from the birth control clinics that began popping up due to this fear that they were in fact pro-eugenics, and self-induced abortion was widespread among these women. Sadly, this fear was not unfounded. In the early 1900s, Margaret Sanger founded the American Birth Control League, which later became Planned Parenthood. Initially, this organization garnered interracial interest as women of color saw birth control as a potential means of social mobility. However, Sanger and the League alienated women of color when she built alliances with the population control establishment. Eugenics proponents, wanting to limit births among women of color, allied with white feminists and funded these early fertility clinics in the hopes that it would reduce the number of births to women of color. Salinger points out that Planned Parenthood was beginning to define motherhood as a class privilege. Quote, "Purposefully or not, these groups gave force to the idea that poor women, especially women of color, should be targets of centrally planned reproductive control, not bearers of reproductive rights." End quote. In partnering with the pro-eugenics movement, white feminists distanced themselves from women of color and pushed their own movement forward without regard for the effect this had on other women. After Roe v. Wade passed in 1973, guaranteeing women the right to an abortion, white women began to see sterilization as another liberating choice they could make about their reproductive health. Quote, "Many white women did not understand why poor women of color saw sterilization as a dangerous medical option and why they called for laws that mandated a 30-day waiting period before a doctor could carry out a sterilization." End quote. Not feeling represented by the white feminist movement and believing that Roe v. Wade did not adequately address their reproductive needs, women of color organized on their own to fight for their rights that were not being represented. Several organizations, including the Committee to End Sterilization Abuse, led the fight for new sterilization regulations and guidelines such as, quote, "that women sign informed consent forms written in the patient's language before the operation, that hospitals honor a 30-day waiting period between the signing and the operation, and that no woman should be coerced into signing a consent form while she was in labor, as well as that no woman should be threatened with loss of welfare benefits when she was handed the consent form." End quote. These organizations won significant political gains despite being opposed by Planned Parenthood and other organizations. Unfortunately, even with new guidelines being passed, women of color still had reason to fear for their reproductive autonomy. A government study revealed that reproductive service providers for indigent women of color were not following these guidelines. Some estimates show that 25 to 50% of Native American women were sterilized during the few years after these new rules went into effect. The Hyde Amendment, passed in 1972, further eroding the reproductive rights of poor women of color by denying public funding for abortions for poor women on Medicaid. Salinger notes that this transformed, quote, "abortion from a woman's right into a consumer's privilege," end quote. Middle-class white women easily adapted to this new right-to-choose framework, while activists of color began focusing on ensuring access to reproductive health services regardless of ability to pay, an issue that white feminists could conveniently ignore. Women of color have struggled to get their needs met not just in the realm of family planning, but when giving birth as well. It was in the early 1900s that births started moving out of the home and into hospitals. Before that time, most births took place in women's homes and were attended by midwives. Hospitals marketed themselves mainly to affluent white women who could afford to birth there, and it became somewhat of a status symbol to give birth in a hospital. Poor women and women of color tended to stay at home to give birth during this time for a variety of reasons. Midwives were not only cheaper than hospitals, but they also provided more services, such as house cleaning and postnatal care. Additionally, forced sterilizations were occurring in hospitals during this time, so many women of color feared birthing there. Midwives were also less likely to be prejudiced about the birthing mother's race and class. Many women in the rural South, white women included, were attended by what were affectionately referred to as granny midwives. These midwives were older African-American women who had been trained in midwifery through apprenticeship with other midwives. The skills they possessed had been passed down from the time of slavery, and they were typically held in very high esteem by their communities. In their essay, Empowered Caretakers, A Historical Perspective on the Roles of Granny Midwives in Rural Alabama, Sheila P. Davis and Cora A. Ingram explain how the process of pregnancy and childbirth was empowering for both the mother and the granny midwife, as this was the one arena where, quote, African-American women experienced a temporary emancipation from a life typified by white oppression and male domination, end quote. Unfortunately, since that time, granny midwives have all but been eradicated from the birthing scene in the U.S. Sadly, affluent white women pushing to have their needs met without taking into account the needs of poor women and women of color were again responsible for the passage of legislation that, while helpful to the women who supported it, was in many ways detrimental to poor women of color. The Shepherd-Towner Maternal and Infancy Protection Act passed in 1921. While this legislation was celebrated as a success due to its improvements to in-hospital maternal and infant health services, it did not alter segregationist policies in hospitals, which relegated the care of African American women to substandard wards and in many hospitals denied them care altogether. The act also resulted in increased scrutiny of the childbirth practices of poor women and granny midwives, and instituted a fee-for-service standard, disrupting reciprocal community networks. This increased scrutiny eventually led to further policies, which largely eliminated granny midwives by the mid-1900s. This regulation of lay midwives began with requirements for state licensure. Lay midwives were placed under the supervision of public health nurse midwives, and they were required to attend monthly meetings where they learned about the new state regulations. They didn't renew their licenses for a variety of reasons, including missing a monthly meeting or, quote, simply because the state boards decided that some midwives were too old to practice, end quote. Granny midwives' reputations were also tarnished as the medical establishment and the state demonized them. Quote, midwives were blamed for the high incidence of infant and maternal mortality among their clients, without any reference to the underlying socioeconomic causes, end quote. Granny midwives were portrayed as dirty, uneducated, and unsafe. And, quote, as women of color and immigrant women internalized these prejudices, many came to see hospital birth as more desirable, end quote. Eventually, traditional granny midwives fell off the map of childbirth options. In the 1960s and 1970s, when many hospital births involved women being strapped down, drugged, left howling in pain for hours, and later on no memory of labor or birth, the desire arose in some women to take back control over their birthing experiences. These women began educating themselves about childbirth and began assisting at each other's births at home with no doctor present. Importantly, these women were affluent and white. Craven notes that, quote, although African American midwives continued to serve marginalized women in the 1970s and 1980s in many areas of the United States, they were invisible enough for the emerging profession of middle-class white midwives to describe itself as a rebirth of midwifery, end quote. This rebirth of midwifery was accompanied by the larger natural childbirth movement, which sought to provide options for women in childbirth. However, while middle-class women can focus on choice as their primary concern in childbirth services, low-income mothers are more concerned with continuity of care and being treated with respect, things that more affluent birthing women can take for granted. As this rebirth of midwifery gained momentum, midwives in many states began to organize for state regulation and legalization of lay midwifery in order to protect themselves from being charged with practicing medicine without a license. Many midwifery lobbies were eventually successful in their struggle for legal recognition. However, the remaining granny midwives were not involved in this political movement, and many of the regulations put in place in order to gain legal status for midwives are not feasible for traditional and granny midwives to comply with. Midwifery in this country has effectively been whitewashed. Given this historical perspective, the enormous reproductive healthcare disparities between white women and women of color today are not all that surprising. For example, in her book, Women of Color and the Reproductive Rights Movement, Jennifer Nelson cites several examples of coercive fertility control campaigns that are going on today. A program called CRACK, really, offers $200 to drug-addicted and recovering women who have 2 children if they agree to sterilization or to use long-term birth control such as Depo-Provera.
That's going on now?
That's going on now. Well, I believe the book was published in the 90s.
Okay.
Additionally, sterilization is currently covered by Medicaid, while abortion is not, thereby making permanent sterilization one of the only options for women who cannot afford to pay out of pocket for abortions or temporary birth control. In these ways, as in the past, the government is still trying to control which women have the right to reproduce on their own terms, and which women's reproductive autonomy needs to be limited by white male politicians. Access to quality prenatal care is also still a struggle for poor women and women of color. While the reproductive options available to affluent white women are growing, these options are often not accessible to women of color who lack the same resources. For example, because the government reimburses doctors at a lower rate than do private insurance companies, many doctors are unwilling to serve women on Medicaid. Additionally, midwifery care, which is the legacy of poor African American women in this country, is typically out of their reach nowadays. For one thing, the negative stereotypes of midwives and home births that were used to eradicate the granny midwives were internalized by many women of color, and those beliefs still linger today. However, it is clear that women of color could benefit greatly from the midwifery model of care. Midwives offer continuity of care, meaning that the pregnant woman sees the same midwife at every prenatal visit and is attended by her at the birth. This is essential for building trust. Additionally, midwives spend much longer with their clients during their prenatal appointments than the average OB, and they help women with issues such as diet, home life, and emotional issues. Jenny Joseph, a midwife working in Central Florida, created an outreach clinic for low-income and uninsured women, which has shown drastic improvements in birth outcomes. She offers the midwifery model of prenatal care to these women, regardless of their place of delivery or ability to pay. Unfortunately, however, her program is an outlier. For the most part, midwifery care remains inaccessible and/or undesirable to poor women and women of color in the U.S. For the most part, Medicaid does not cover out-of-hospital midwives, and low-income women can't afford to pay out of pocket for their services. Additionally, the midwifery profession as a whole is largely white. Thus, midwifery care is rather uninviting to women of color who want a care provider they feel they can connect with and who understands where they are coming from. A long history of racial and class prejudices have impacted the current state of reproductive outcomes and access to reproductive care in the U.S. Sadly, the struggle of women of color to receive adequate reproductive health care has remained largely invisible to those who have the privilege of not being affected by racial prejudice in the healthcare system. The history of affluent white women winning political gains for their reproductive autonomy is also a history of affluent white women ignoring the needs of poor women and women of color. From a white feminist perspective, the story might look like a story of progress, though much progress still needs to be made, even for white women. However, when the other sides of the story become visible and when you begin to look at reproductive outcomes for all women, not just white women, it becomes clear that if we want to talk about progress in reproductive health, we need to talk about progress for all women, not just white women. Pushing one agenda ahead without considering the effect it will have on all women will only serve to widen the disparity in outcomes, and women, all women, will not be liberated or served. Knowledge of this complicated history is essential to understanding where we are today and how we can move forward. All women deserve to have reproductive autonomy and to receive adequate and ideally excellent care during pregnancy, birth, and the postpartum period. We need to focus on making changes for the population of women whose outcomes are the worst. Until their needs are addressed, all women will continue to be oppressed.
Brava.
That's my paper.
Outstanding. So I would love to ask you maybe a couple questions. It's very well done. I was over to the moon reading it. And where were your references for your work? Where did you find the information that you used to make as part of your paper?
Several different books. Do you want me to name them?
Please.
So we had, I looked at Jenny Joseph's website, which is commonsensechildbirth.org.
She's a wonderful person.
She's doing amazing, amazing work.
Did you get to talk to her during
No, I didn't.
Yeah. I got to way better.
Yeah, I saw her.
Hi, Samsarah.
I basked in her glory.
Yes, yes.
Then there was a book by Krista Craven called Pushing for Midwives, Home Birth Mothers and the Reproductive Rights Movement.
Right.
That's actually one of the books that first sort of sparked my interest a little bit, because it wasn't a book I picked up because it specifically was dealing with race. But it sort of started talking about these issues, and I was like learning things I didn't know. I was like, oh, that's interesting, and I want to know more about that.
Excellent.
Then there was a book you lent me, Wings of Gauze, Women of Color and the Experience of Health and Illness. There were a couple of essays in that specifically that I looked at. One was Empowered Caretakers, a historical perspective on the roles of granny midwives in rural Alabama, by Sheila Davis and Cora Ingram. And the other essay in that book was Childbirth, Lay Institution Building, and Health Policy, the Traditional Childbearing Group Incorporated of Boston in a Historical Context, by Gloria Waite. And then two really information-packed books, Women of Color and the Reproductive Rights Movement by Jennifer Nelson, and Pregnancy and Power, A Short History of Reproductive Politics in America by Ricky Solinger. And, you know, when I was doing the research for this paper, it was really actually hard for me to finally sit down and start writing, because I kept feeling like there was just so much more that I could read and learn, and I could write volumes of books about it.
I'm sure you could.
And so I got to a point where I was like, you know what? I have to just sit down and start writing something. This isn't about, you know, writing something that... It was about my learning process and exploring these issues, but yeah, it really opened a lot of windows and doors too, of just how much is out there to really dig deep into it.
It's as deep as the history of the country and beyond.
Yeah.
So what gravitated you towards the topic at all? So there's all these topics that you could have written about, and the class allows you to pick any and all: pregnancy, birth, postpartum. What drew you to this topic?
I would say there are a lot of answers to that question, but the biggest one I would say is my experience working with birthing women of color, and what they taught me, and what they taught me about what I still needed to learn.
Can you give me an example of that? Like, what did you see? Because you're very forthright, you know, forthcoming and talking about your experience growing up middle class and having that privilege. And then what did you see in working with our clients that spoke to you, challenged you maybe?
Yeah. I saw a lot of things. One of what was probably the hardest for me to see, though, and maybe was more the inspiration for this paper in specific, was seeing the way they were treated by healthcare professionals as compared to white women that I've worked with. Seeing the care that they received, seeing the...
What did you see?
I saw them being treated disrespectfully. I saw them not being given information that they needed and even requested. I saw them not being respected when they tried to speak up for themselves and what they wanted. I saw them not being listened to, just being ignored.
So what did you, as a doula, how you saw these things happening, how did you see your role when you're watching this happening with a client? What did you do?
So, well, in cases where I felt like they weren't receiving proper care and information, I tried to do what I could to sort of fill in the gaps and make sure they were getting the information they needed and wanted. And then I did what I could to support them in making the decisions that they felt right in the context of that hospital situation. I also, in some cases, tried to use my privilege to interact with the hospital staff in a way that they weren't able to, when I was feeling like my client was being really disrespected. I sort of said, okay, let me go talk to this nurse, and because I was just seeing them not even listen to her, not even
Do you think that the hospital staff was aware that they were doing that?
Probably not.
Is this unconscious phase of not seeing? And that's the heart of racism, is to just not see each other, and to this. It's amazing.
And you know how I could then go say something that my client has been saying, and suddenly they hear it.
Right. So you're able to be that bridge. You're able to carry the message of your client to wake up the healthcare provider, who then hopefully would respond for your client's behalf. Good for you. How did you feel doing that? How did it feel to do that?
Well, to do that, it felt... I didn't like that I had to do that. It felt really wrong. And when I see my clients being treated poorly, you know, it hurts me. But there is like a little bit of empowerment in seeing how I can use my privilege in a positive way. And that's something that I'm working on too, and practicing and trying to figure out how that plays into it. Because there is some empowerment for me there, but at the same time I have to be careful, like what is mine to deal with and what is my client's to do. Having
boundaries, exactly. You're not there to save anyone.
Right.
You're there to do your own best good work. Good job. So now that your paper is done, how do you feel about the whole journey of having written the paper? How are you feeling about your journey of being a participant in the class itself?
Very positive. Doing the paper was a really positive experience. I'm really glad that I did it. You know, like I said, I was sort of starting to dig into these issues in a lot of different ways, but really sitting down with the books and getting the history was really important. Especially as I look at not just doing direct care, but also looking at like political work and I think that in terms of moving forward and working with more women of color, I have a better understanding of what their history is and where they're coming from.
Exactly. Is being a midwife on your horizon? Coolness. That makes me happy.
Makes me happy too.
And what is your general feelings like if you were going to talk to somebody about the class you're a participant in now, the practice that you're a member of? Give the commercial. How do you feel about having gone through this particular process as opposed to maybe other doula trainings?
Sure. I feel like the commercial that I can give my audience is other white folks. Because in talking about what's been the most valuable to me about the class, it's been what I've learned about cultural competency. It's been the experience I've gained working with both clients who are people of color and also being in community with birth workers of color. You know, I've learned things that I didn't know I didn't know. So there's that, and then there's also the community aspect of it in general, regardless of what color all the other doulas and teachers are, that this class provides that other programs don't. And I did participate in another training program, so I'm not speaking in a vacuum of experience, and I didn't feel that they provided enough support, mentoring, follow through. It was kind of just, you do this training and then we throw you to the wolves and you figure it out. Whereas with this training, I really felt supported every step of the way. And if I had questions, there were people I could talk to. There were people I could process things with. It was more than just learning to be a doula and a good doula. It was a personal journey of growth and development. And I know that I'm not just a better doula for it. I'm a better person. So thank you.
Thank you, honey. That's very sweet. I'm happy to hear that. That's my goal. And I just want to say, I want to get recorded and saying that your work was incredibly impressive, and how you just really came into this class and into this practice was kind of on fire to get this work done. And all the reviews, all of your clients love you. They loved you enough to fight with you. They loved you enough to fire you and rehire you. You know? And that says a lot. That just shows the level of engagement that you had with your clients. And the one who fires you is now texting you and your BFF now. It's really cute. Mm-hmm. And it's like, yeah, they really had this beautiful, positive experience. It's like, you're a member of the family when people feel secure enough to fuss with you a little bit, but always on a professional key, always on the right psychological mark. So I was never concerned. I feel very blessed that you chose my class. I feel very blessed that there are birth workers of privilege who have the skills to give good care to all mamas, and specifically mamas of color, and I trust that makes a deeper, more powerful women overall, so that when it's time for you, when you decide you want to be a mama, you have the experience of having tended other women to fuel your mothering and fuel your life as a partner and woman in the community. So it's just beauty all around. So thank you for your wonderful paper and allowing me to film you. And we're going to turn it off now. Okay. Say bye-bye.
Bye-bye.
Bye-bye in YouTube land.